Hello? Yes, you're on the air. Where are you calling from? Gone. Is there a quick test that you can do in your office? Somebody comes in. Can you do a swab or anything like that?
We can do vag swabs, mouth swabs, anal swabs, and if you've got a good lab, you can culture yeast. But again, everybody has some yeast.
Do you have to culture it? I mean, can you look at it under a microscope right there and then and see the little yeasties moving around down there?
That would take some time. I'm
Would
sure
it?
you could.
I
Yeah.
see.
Yeah, because they are easy to see. But again, the history is important. The culture sometimes is negative, even though you see an obvious vaginal yeast discharge. Sometimes you can culture that and it comes back negative. You've seen that. Why would that
Yes.
be?
I don't know why the cultures wouldn't grow, but several articles, review articles, where they studied a number of healthy women, that 30% of them had positive cultures for yeast, even though they had no symptoms. They gave them some antibiotics, some tetracycline for 24 hours, and 100% they could culture it. So it kind of brought them out where it could be cultured. So the yeast is there. But since everybody's got it, I think smears and cultures aren't the way to diagnose the yeast-related problems we're talking about.
Would the tetracycline and the yeast have a similar response, though, to the test? Would you be getting a false positive from the tetracycline?
No, I think the tetracycline is known to wipe out a lot of your friendly bacteria, and this lets the yeast overgrow. But I don't know why the tetracycline would cause a positive
Okay,
test.
the machine gun outside the bank again.
Right, right.
Okay.
Right.
Yes, another call. You're on the air. Where are you calling from, please?
Toronto.
Go ahead.
I'd like to know, if you know that you have a yeast infection, a vaginal yeast infection, is there anything that you can do while you're waiting to get into a doctor to deal with it at home?
Carol?
Yes, I would say I tell my patients to change their diet for one thing. It's hard to understand it, but what goes in your mouth can then grow in the vagina. Change the diet, cut down on sugar and yeast-producing foods. Some women can use baking soda douche. Some women will use yogurt douche or yogurt suppositories that are found in the health food stores.
Would the yogurt douche or the baking soda douche have, under any circumstances, an adverse effect? Under any circumstances?
If a baking soda douche is used in too strong solution,
Yes.
that can irritate the membranes of the vagina.
Right. Because you don't want to go poking around, do you?
Well, a lot of women use douches. Douches are an over-the-counter item in any drugstore, and they can be just a saline solution to flush out.
Are some douches unsafe in terms of yeast connection?
Unsafe. Well,
would they promote yeast infection?
I wonder about apple cider or cider vinegar or vinegar douches, because it's an acid environment. Yeast like acid, but I think a lot of people have used them for yeast, and the flushing mechanism works. Have you heard about that?
Perhaps, but I'm going to go to the home treatment measure. People take enemas. And so I think people can take a douche quite safely as a home thing, and I would recommend it's less messy. And the nurse who works with me has them get the acidophilus powder from a health food store, put a teaspoon.
Acidophilus?
Yes, this is the lactobacillus. There are a number of different brands, and it has the friendly bacteria. I think that's a very good thing that she could use very easily, and it often helps control the vaginitis.
Okay. Let's take another call. Yes, where are you calling from, please? Hello? Try another one. Are you there? I think we've got you, have we?
Yes, hi.
Okay, would you speak up a touch, please?
Okay, I'm calling from Montreal.
Go ahead.
I have a question about vaginal yeast infection that's been diagnosed, and it's been going on for a couple of years now. The thing is that it could be trichomonia, I think, or gonorrhea connected. And I'm wondering, like, if there's treatment outside of antibiotics, because that's the only way it's been treated for the past 2 years, and being passed to the mate and back to the woman, if that's possible, and what can be done for it.
I presume, since two of the germs that you mentioned must be determined by bacteriological examination, that you mentioned gonorrhea and you also mentioned trichomonas. And so they require specific drugs that your doctor may need to prescribe. But the Candida yeast is the most common cause of a vaginal infection, and one of the resource references in my book mentioned by Dr. Brodsky comes from the Journal of the American Medical Association, that if you do not get rid of the yeast in the digestive tract, that you won't get rid of the vaginal yeast infection. It's a reservoir that feeds it. And again, the immune system is not strong, or she wouldn't keep having it. Now, she brought up another very important point of treating the marital partner. And even though a man on his penis doesn't have the damp, moist areas unless he's circumcised, that men may pass it back and forth, and I think a man needs to be treated if his wife has the yeast-related problem. That means he may need to have the diet and the nystatin. Now, one other thing I'd like to bring up is what we call immunotherapy. And we discuss this again in the book. And there are several articles in a distinguished medical journal, the Annals of Allergy, where physicians gave Candida vaccine to strengthen the immune system. And the immune system helps fight the yeast off. Now, then one other thing. Harry, do you know what homeopathic therapy is?
Yes.
Tiny, tiny doses.
Yes.
Now, this is used, and there are homeopathic vaccines available. Now, I have not used them broadly, but I talked at the La Leche League in Washington last year, and 2 women in the audience told me, we have used homeopathic medicines. This is very weak Candida extract by mouth. It helped our vaginitis, and there is a double-blind scientific study in October 1986, Lancet, about homeopathic. I do not understand how it works, but again, this may be one other resource that may help a person.
How infectious is this condition, Carolyn?
The Candida Research Group in California, in their latest newsletter, said that all partners of infected females are very susceptible and probably should be treated. And this is asymptomatic partners, so I think there's going to be quite a stir out there in the population. They say it's very infectious.
Would it be infectious for homosexual relationships?
I would feel certain it would be. It passed from person to person by intimate sexual contact.
Okay. How about AIDS?
Okay. An article in the New England Journal about 2 years ago said that every person with AIDS has such a weakened immune system that this Candida jumps aboard, and they have thrush in the mouth, these white plaques in their mouth. Now,
that's a person who already has AIDS.
Yeah, a person who already has AIDS. And so I posed this question, and I discussed it in the book, to Dr. Alan Levin, a San Francisco, Harvard-trained immunologist. I said, suppose you had 2 people who have what we call the AIDS-related complex, the ARC, or who don't have AIDS, but who have a positive blood test for AIDS. And one of them takes a lot of tetracycline or these other antibiotics and eats a diet high in sugar and has a poor lifestyle. And another person who has a good lifestyle and doesn't take antibiotic drugs, which one is more apt to get AIDS, even though both have the virus? Well, the one who takes the tetracycline and the things that promote the Candida. And so he uses nystatin in his patients with AIDS to hold the Candida down, and he feels like it makes them live longer.
So a Candida